29 million people in the United States have diabetes, and about 1.7 million came down with diabetes in 2012, and the numbers are climbing. A relatively common problem of diabetes is called diabetic retinopathy. And to tell us about that today, we have Dr. Mark Barakat from Retinal Consultants of Arizona, an ophthalmologist. Nice to have you with us, Dr. Barakat.
Pleasure to be here. Thank you.
So diabetes is not a great disease to have, number one, and there are all kinds of things that happen, but one of the big ones is this disease, retinopathy. What is that, Dr.
Absolutely,
Barakat?
yeah. No, diabetic retinopathy is obviously a huge problem. It's actually broken down into several different categories. There's the swelling of the center of the retina being the back of the eye. Mm-hmm. It's almost a film in the camera, so to speak. And diabetes affects the blood vessels in the entire body, but in particular the small blood vessels.
Whoa, okay. So how does that affect a diabetic's vision when that happens?
Well, it causes bleeding and swelling within the retina, which causes distortion, which causes blurry vision, can cause bleeding within the eye itself, which causes cloudy vision, or for that matter, in its ultimate and final stages, it can even cause a lot of scarring, which can cause retinal detachment and ultimately blinding.
Ooh, yeah. That is bad. Now, do all diabetics have this retinopathy, or is there something that brings it on?
Well, not all diabetics have retinopathy, although unfortunately it's very, very common. Typically it takes about 5 years from the onset of diabetes on average for you to get it. The problem being is that most of us that do develop diabetes don't even know when we develop it. You mentioned the statistics about how many people have diabetes. What's even scarier in some ways, frankly, is that in the US alone, adults over the age of 20, about 1 out of every 3 are pre-diabetic.
Really?
So it's an epidemic that will only worsen with time. So that's why the exam of the eyes, actually an annual exam, is critical, really because important. Early intervention does make a big difference.
Right. Is this diabetes that's on the rise? Is this both kinds of diabetes, both genetic and what, diet related? Well,
the biggest rise is in diabetic type 1, and we're not quite sure why this is happening. There's a lot of different theories. There's maybe epigenetics, maybe the diet that we're having. There's also some ideas about genetically modified foods, although it's very hard to support that, very hard to tease that out.
At this point, it's kind of a new thing for us.
Absolutely.
But nevertheless, whatever, it's bad. Now, what are the symptoms of this retinopathy, Dr. Barakat?
Well, symptoms of retinopathy can vary from almost none and very subtle to as I mentioned, devastating. Most people will notice some distortion in their vision, some cloudiness. They may go in to get a new pair of glasses because they think, well, something is a little off, and then discover only on dilated fundus examination that there is an issue that needs to be medically treated. Sometimes the symptoms are quite obvious. Some people wake up one day and realize that one side of their vision is completely cloudy, and that could be something such as bleeding inside the eye.
Do people without diabetes, is this something that they get as well, a little variation of retinopathy?
Well, you can get retinopathies, you can get things that affect the macula and different conditions that can mimic this sort of condition. But what's the biggest problem with the diabetic retinopathy is that it affects people at such an early age. Whereas in other conditions, it's reserved for those over the age of 65 and 70. This might hit you in your working years.
Oh, and as you said, you're talking about people 20 years, as young as 20 years and older, that are getting more diabetes, and obviously they're going to have more of this retinopathy. How about treatment, and is there a cure for it?
Well, the cure really eludes us. The cure of diabetes is to treat the underlying condition, and so far, while there's been some strides in trying to cure diabetes per se, we haven't gotten there yet. What we can do is treat the eye. And the treatment of the eye consists of a variety of things, such as laser treatment or injections of several different kinds of medications, such as steroids or other factors that can actually help with the swelling and calm down the bleeding. The goal really being that as well with blood sugar and blood pressure control, you want to control the eye early on to prevent further vision loss.
Sure, because you mentioned it is the pressure from the blood that causes that?
Well, it's less the pressure, it's more that the blood vessels essentially break down and cause leaking and bleeding within the eye.
Dang. Okay, so you can treat it. Can you get rid of retinopathy for diabetics if it happens?
You can certainly stabilize it. You can absolutely stabilize it. And I have a lot of patients with diabetic retinopathy that do quite well. But a large part of that is also, really, frankly, the patient's responsibility. They go to the primary care doctor, they control everything that they can control from their end, they follow up, and we treat them as aggressively as we can.
Yeah.
Yeah.
Now, you mentioned that yearly eye exams are really important. Now, this is important for everyone, right? Not just diabetics, but extra important.
It's even more pivotal. I mean, frankly, once-a-year examinations for diabetics is really the bare minimum. I have some diabetics that I see every month, or every 3 months, or every 6 months, depending on how severe and how progressed they are and on what they may need.
Now, can they avoid this eye disease if they do that, do you think? Can it be avoided?
It can be avoided to some degree. I think once you have diabetes for a long enough time period, you will develop some degree of retinopathy, but maybe not to the threshold of needing treatment and having good vision. So absolutely, there's some people that have diabetes for 10, 15, 20 years, but they are excellent at controlling the blood sugars and blood pressures, and life is good, and I see them once a year, and I congratulate them, saying, keep up the good work.
Well, it would be devastating to lose your eyesight.
Absolutely.
Just, you know, at any age, it would be devastating. So it doesn't sound like it's too bad to just keep track of it, you know, get your exams and that kind of thing. Now, you were mentioning before the show, Dr. Barakat, that you come to the Prescott area every Friday?
I come to Prescott every Friday and alternate with Prescott Valley on other Fridays.
Right, so Retinal Consultants of Arizona is here, you're up here. Do you see any different or more prevalent kinds of eye diseases in this area than you would expect?
No, I think you get your share of, unfortunately, diabetic retinopathy in this area as well as macular degeneration and things of that nature. But it's pretty much along with the same pattern that you see across the rest of the state.
Right. So early treatment, I know we've talked about macular degeneration, that kind of thing, but it seems like that prevention factor, that catching things early, like with cancer or other kinds of diseases, that seems to be pretty important.
Right. We, as a medical community, we're much, much better at treating it before it snowballs into a bigger problem.
Right.
I mean, yes, can people recover from such as diabetic retinopathy once it starts detaching? Absolutely, but then you're going from the clinical arena to a surgical field where one would need a surgery for that. And the greater the intervention, obviously, the greater the risk, and who knows how good the prognosis will be. So you're always better off, although sometimes it's a hard sales pitch, saying, well, you know, your vision's not that bad, however, I see this, let's tweak it a little bit now before it becomes a problem.
Yeah, get serious. Well, and for those folks who maybe are not going to have diabetes and retinopathy or macular degeneration and stuff, they're still, as the eyes age, they start having problems. Is there, I know the cones and rods harden or something said, but you know, about 45 you start having to have, you know, little reader glasses and things. So what can people do just about their regular eye care, and can you prevent those kinds of age-related situations?
Unfortunately, some things we absolutely have no control over. I tell my patients there's some component of birthdays and dumb luck.
Right.
But I do think that if you continue to get seen and get regular care, then we can try to curb it as much as humanly possible, and again, avoid as much intervention as we can.
Yeah, it's true. Well, you have some really neat things out. I always enjoy, you know, the new things that come along, like the mono contact for those folks who, you know, if you need cheaters, you have to give a speech. I mean, this has happened to me where, you know, I want to wear those horrible little granny glasses, right? So you can put this one contact in, and it's you can see close up.
It's a wonderful thing. Not everybody can tolerate the amount of contact, but for those that do, it's very liberating. Absolutely.
Yeah. I know people who've used that, and it's absolutely clear with myself. No matter how long I wear them, it's still a little blurry in the distance, and it's still a little blurry up front. Not a lot. It's just not crystal clear, but that's great. Hey, you can even change your eye color.
Absolutely.
You know?
Of course, I'm a hypocrite. I could never put a contact lens in my eye, but.
Great. Yeah. An eye doctor who won't wear contacts, where you probably don't need them. But it's always fun. You know, I always thought I liked blue eyes, and so, hey, I got some blue contacts. And
there you go.
You know, of course, with brown eyes, it's just sort of like, are your eyes like blue-brown? No. But it's nice. So where are the retinal consultants located then? Because I know you have a lot of locations around Arizona.
We have about 32 different locations across the state. Here in town, we are at the Kokopelli Eye Centers.
Oh, okay.
Yeah.
Both in Prescott and
Both in
Prescott
Prescott
Valley,
and Prescott
as you
Valley,
mentioned.
absolutely. Yeah, on Fridays, and I believe Dr. Kunimoto from our group is here on Tuesdays as well.
Yeah, he's been on the show
Yes.
talking about different
Yes,
other
I've
eye
seen
problems.
him, yes.
Yeah. So I love the test too. When you go in to get your little eyes tested, you know, they have all kinds of things. You feel like you're in an obstacle course. Like if you have a dog, like an agility course, it's sort of like that.
Absolutely, yeah, we put
Yeah.
you through your paces.
But it's absolutely painless. And that's the great thing, is that people need to get in for a yearly exam at least, no matter what their situation is, and make sure
Couldn't agree
that their
more.
eyes are okay.
Absolutely.
Wow. Well, thanks for joining us, Dr. Mark Barakat.
Thanks for having
the
me.
Retinal Consultants of Arizona.
It's been a pleasure.
All right.